Hi, my name is George Pedros and I'm a licensed hypnotherapist and master NLP practitioner dedicated to helping people with chronic health issues. In this short video, I would like to talk about one of the greatest problems in our society, depression. Now, before we continue, I want to say that if you or anyone you know are in a crisis situation, you should phone Lifeline on 131114. That's 13 11 14. They are available 24 hours a day. I have provided a quote from Beyond Blue as a working definition for depression, and to paraphrase it slightly, they say that although we all feel sad, moody or low from time to time, some people experience these feelings intensely for long periods of time, which can be weeks, months or even years, and sometimes without any apparent reason. Depression is more than just a low mood. It's a serious condition that can affect your physical and mental health. A bit of online research showed that according to the latest estimates from the World Health Organization, 1.3 million Australians, that's 5.9% of the population, are experiencing a depressive disorder right now. This is the highest rate of depression amongst countries in the Western Pacific region, with New Zealand following close behind at 5.4% of its population. Australia's rate is at the same as that of the United States. The problem is that people who are diagnosed with depression cycle through periods of life where they may get better through treatments including medication, but then go back into depression. The problem at the center of this is that people that are depressed make bad decisions, which get them into depressive episodes again and again. It's common for people suffering from depression to be stuck with what happened in the past, to keep going over and over. A thinking process called rumination. They keep analysing and playing what-if scenarios. Now, don't get me wrong, it's important to analyse things, to make a decision and move on. That's actually a good thing, but many people get stuck in this cycle. A serious problem, which I take very seriously myself. Not only do I help people with depression, but have had personal experience with this myself. So I understand the problem and the stresses this causes on many levels. Personal, family and career. There is good news though. There is now an improved understanding of depression and other mental disorders, and a greater acceptance within the community, and a general loss in the stigma that was associated with depression and anxiety. What I see and I am able to help people with is the underlying cause for the depression, and that is the way we think, the way we process events and interactions in our lives. We learn these patterns of thinking and behaving early on, usually from our parents and caregivers, who themselves got their thinking from a generation before. Even though these people had the very best of intentions, they cared about safety, about survival, and this was reflected in how they spoke and behaved in front of us. Situations have changed, however. The world has changed. We no longer have the same problems people did 50 or 100 years ago. We have different challenges now, and that older thinking doesn't serve us very well. I saw in my inbox a few days ago an article about depression from Scientific American. It was published on February 10th, 2020, and it's titled, "Is an Antidepressant Right for You? Ask Your Brainwaves." I've got a copy here. For a long time, scientists and clinicians have hoped for a biological means, basically something, maybe a hormone or chemical that could be found in a blood test, that could help with diagnosing depression or predicting which patients will do better on a given treatment. In this article, they discuss a new concept of studying brainwave signals, that's EEGs, taking a step towards the concept of trying to work out which treatment or drug might be more effective to which brain pattern. This is coming very much from a pharmaceutical approach, so to try and find which antidepressant or antipsychotic might work best for you. The article confirms that today's psychiatric drugs do not work much better than a placebo or sugar pill for many people, which has given them the reputation of being ineffective. But the problem may be the diagnosis, not the drug, the scientist in this study, Dr. Etkin, said. He went on to say that the current way the medical community diagnoses is imprecise because it is not tied to the biology of the condition. It's important to remember that these brainwave patterns, these EEGs, can't actually read a person's thoughts. Instead, it connects the neuronal patterns the brainwave patterns, with actions or mental states or patterns of thinking, which goes to what I've been saying. It's the patterns of thinking which express themselves in different electrical activity, which should be the aim of treatment. Not trying to find a drug which tries to diminish this wave pattern, because as important as this pattern of thinking is in getting you in the wrong frame of mind, so too is it important to develop a new pattern of thinking to get you back on track. Depression and anxiety do affect many aspects of life. It's important to remember that interpersonal relationships do suffer, and this can exacerbate the problem. Worse still, depression can have a negative impact on our health. This can manifest as blood pressure problems, chest pains, digestive problems, chronic and autoimmune diseases, as well as insomnia, which leads to further health problems. As I mentioned earlier, I find that the source of these patterns of thinking that make us behave this way start early on. It can be a feeling of not being good enough, of not being able to put things in context, as well as the belief that you have no control of the outside world. We run different patterns of thinking from our early childhood experiences. We are sponges at those tender years, and we are soaking up experiences. We see what consequences there are for behaving one way or another. We are finely tuned at reading the facial expressions of those around us, especially our parents, and we try and make sense of each and every action. The trouble is, that was a long time ago. Those people, even though they had the best of intentions, probably did not have the right tools to do the best they could. It's not that they were not good or not bad, they simply did the best they could under the circumstances. And we were taking all this in with not yet developed brains. Our prefrontal cortex, which applies meaning to things, that part of the brain which puts things in context, doesn't fully mature until about 25 years of age. Fast forward to now, we find ourselves facing new challenges and processing those thoughts and feelings, whether interpersonal or career-related, in a similar way, which may not be the right way, with an overbearing feeling of dread and catastrophe. I've said it before, the way we think and process events is like a software program. Apple, Microsoft, and other tech companies are constantly doing software upgrades, adding new bits of code, removing outdated bits of code, so the operating system works better, more efficiently in the ever-changing environment. Even Apple knows it is best to run these updates at night when you're sleeping. The difference though is that hypnotherapy has another dimension. It allows us to tap into the subconscious by getting you in the right state, the zone. You'll find that you do have the control, you do have that inner wisdom that will allow you to create the changes that you need to do right now. Strategic hypnotherapy uses an understanding of neuroscience, along with an evolution of the art of hypnosis to help people who have been stuck in a helpless cycle change their pattern of thinking and behavior for good. I am really humbled when I see people make such incredible changes to their lives in such a positive way. As I say to them, they are the captain of their ship, I'm but their navigator. So if you or someone you know suffers from depression and would like to break free, you can get in touch with me through my website helpmypain.com.au or through Facebook. And as I say, hypnosis isn't magic, but there sure is something magical about it. Thank you for watching.